Um, Hello and welcome to the partnership at Drug Free New Hampshire's Prevention Week Facebook Live series. We've invited prevention specialists from a variety of roles from across the state of New Hampshire to join us and share their story, their prevention story, their expertise, and their experience with this year's topic, strengthening community, building resilience, and creating hope. And I'm really excited to have Celeste Clark here with me today from the Raymond Coalition for Youth for today's topic, which is strengthening community resilience, substance misuse, and overdose prevention. So welcome, Celeste. Nice to see you.
Good morning, Julie. Thank you so much for inviting me to be a part of this series and to represent the Raymond Coalition for Youth. It's an exciting opportunity.
Great, thanks. And if we have listeners out there, go ahead and let us know where you're coming in from, where you're streaming from, and we'd love to know who in our community is out there. Just you can go ahead and put a comment in, and we'll also be taking questions as well. So this is a really big topic, Celeste. This is really, preventing substance misuse and overdose. It's the core of our work. There's a lot of pieces that go into it. It's a big task and an important one, and one that I know you've been working on for a number of years. Can you just share a little bit about how Raymond Coalition for Youth has been working on this really big goal?
Sure, I'd be happy to. So in this year, 2022, the Raymond Coalition for Youth is celebrating 20 years of promoting positive, healthy choices for youth, which is really exciting for us. But it speaks to the importance of our work and the many people who have been a part of that over the years. I think that it's important to recognize that a coalition doing community work really is made up of the community and all of the partners who are in the community who care about making a difference. While it's nice to say that we all make a difference individually, together we really make an impact when we work for a common goal. And that's really what coalition building is about, finding out what that common goal is and then how we can all play a part in making a difference in our community.
That's great. Can you give us a little, what your goal is at the coalition and how you, a couple of examples of how you work together to do that, to have an impact on that goal?
Sure. So the Raymond Coalition for Youth has been lucky that we've had a drug-free community grant from 2010 to 2020. And when you get that grant, there's a lot of checks and balances that are put in place that you have to accomplish to receive that funding and then to continue getting that funding. And one of the things is that we're a data-driven coalition. So everything that we do, we look at the data that we have, which in our case, we use the Youth Risk Behavior Survey. And then the goals that we use comes from that. So we work with our young people. Our young people definitely have a voice in everything that we do, and we identify the concerns. So the two goals that we really focus on is bringing the community together and increasing community collaboration, and then reducing youth substance misuse. That's been the goal since the coalition started. And I can tell you when we first started, Raymond reported higher than state average drug use for alcohol, marijuana, tobacco, and other drugs compared with the state of New Hampshire as a whole. But in 2019, when we had our last youth risk behavior survey that we have the data from at this point, Raymond had lower than state averages in all of those categories. So we're pretty excited about that. And that did not happen by itself, right? That was a lot of effort that was put in place, a lot of collaboration and looking at strategies to help reduce those numbers.
That's great. Thank you. What is something that you have done that might have contributed to that?
I think, again, it's the bringing people together and listening. We do a community survey every year to find out what's going well, what we could work on, what we could improve upon. And we always hear over and over again that the coalition listens to the community. We listen to the concerns, and then we try to put things in place to address those things. So listening is really important to make sure people know that they're a part of the process.
Mm-hmm. That's great. And you've mentioned this, that Raymond is a drug-free community, mm-hmm. and was from 2010 to 2020. which is a great resource, right? To be identified and have those inputs. I guess, first of all, could you explain what a drug-free community is and what that means and how that has been able to support the coalition?
Sure. I liken it to, so a drug-free community is a grant program, and it's you can have up to 10 years of federal funding that you receive in 5-year increments. So years 1 to 5 and then 6 to 10. And to apply, it's quite a process to apply. You have to show that you're an established coalition, that you're doing the work in the community, so you can build upon that. And I liken it when I have a conversation like this, that when the coalition first started, we were a group of people who got together and wanted to make a difference in our community. And we were doing good things, and we all felt really good inside about that, right? We had that warm, fuzzy feeling of doing good work. But when you get a drug-free community coalition, they put you through so much training and to understand how important substance misuse prevention is. And you go from being a group of people doing good work to being a group of people who are really showing an impact in the community, and you have measurable success, and you have to collect that data, and you have to show those measures of how many people are involved, what the strategies are that you're working on. So it's really a whole checks and balances that, yes, they're giving you money, but you have to give them back some results saying what you're doing with that money and how you're making an impact. And if your numbers aren't going in the right direction, then you evaluate that and you see what happened. And maybe that wasn't the issue that we should have been working on. We should have been working on something else, or we needed a different strategy. But it's all checks and balances, having conversations and collaborating with your partners to make a difference.
That's great. Thank you. So that really struck me, is that, and I'm curious about this, before you became a drug-free community, there was already a coalition working together. How did that start? You know, how did a group of people who wanted to work on something together find each other? You know, because I'm sure there are listeners that are like, I care about youth. I care about preventing substance misuse. I care about creating community connection. But how do I find like people and come together? How did that start? And what advice would you have, you know, for people who are seeking a similar to do the same?
Great question. So I never anticipated being in this seat and doing this work from when I started. At the time, the University of New Hampshire had a grant to work with Raymond, again, to address that key finding of data from the Youth Risk Behavior Survey. And they came into our community and they assembled a group of people, all of the movers and shakers, if you will, the top people, the chief of police, the superintendent, all of the principals, faith-based leaders, all of your key people that you would expect. And I had heard about the meeting at my church. Somebody had come and spoken at the church and was talking about it, but they didn't really give this is where you need to go at this time, at this date. So that original meeting happened. And at the time I was the PTO president, and my principal came back to the school and he said, you know, I was invited to this meeting. I'm the elementary school principal. I don't need to be talking about drugs and alcohol, but if I don't go back, I need to have somebody else go in my place. So I want you to go in my place. And it just, I had heard about it, right? I was a mom of 4 kids in the school district, and it was something, they were talking about things that were of interest to me for my children. So I happily went to the meeting, and the meeting started with 42 people, the first one. It went down to like 20 some people immediately the second meeting, right? And kind of weeded out the people who thought it wasn't for them. And then we ended up with a core group of 10 people probably who continued these conversations and worked with UNH. And at the time, whenever we would have a meeting and introduce ourselves, again, it would be the chief of police, the principals, the people from the medical center, the people from the mental health facility, and then me as a parent. And I'd say, I'm just a parent. They're like, no, you're really important. I'm like, no, really, I don't have a title. I'm just a parent. I just want to make a difference. And they made me feel so important and so a part of that community of people that wanted to make a change. And to this day, when we have a coalition meeting and we go around and do introductions, and the parents that are in the room, we're just parents. I'm like, you have no idea how important you are, how important you're the voice of your kids. You're the voice of what your kids are going through. So the takeaway for that is that everybody is important at the table. No matter where you come from, what your background is, you have something to contribute and you can make a difference.
That's a great takeaway, right? Everyone has a role, and everyone in a community has a role. So UNH had a grant. Again, there's this influx of funding and this influx of expertise that came in. What can everyone who, as we just identified, that plays a role in their communities, without that, right? What can we do after we get off this call today? This Facebook stream live. It's my first time, everyone. And this idea of the theme of the week, right? Of strengthening community, building resilience, and creating hope. What role do we each play in that? With absent of a coalition, what can we be doing? What can you tell our listeners that we can each do to support?
I think it's important to note that UNH came in with a grant for 2 years back in 2000. They left in 2002. And the group of people, and again, at that point when they left, we were probably down to 7 or 8 people. And we could either stop doing what we were working on or else take that foundation that we built and move forward with it. And that's exactly what we did. We had no money. We had no funding. We just had like a core group of people who were committed to continuing the work. And I think any community can do that, right? Lots of schools, and you can find out if the school district that you're in collects the youth risk behavior survey data, but you can use that as your starting point, or more importantly, talk to the kids in your community or other parents, because sometimes the issues that we think are issues by ourselves, if we start talking to somebody else, maybe that's not the exact issue, but maybe it's something that contributes to a bigger issue. So you can have those just get people together in a room and start a conversation and see where you can go from there. You don't need money to do that. You just need a desire to make a difference. And as far as, I would also recommend seeing if there's something in your community that's already happening. I mean, there are several different drug-free community coalitions located throughout the state of New Hampshire. We also have 13 regional public health networks that are doing great work. So there are some things that are happening already. And then there are organic coalitions also, or groups of people, maybe they don't even consider themselves a coalition, that are doing this great work, and you can join their efforts. It's much easier to join an effort that's already happening than to create a whole new effort. And you can, even if the existing effort is there, they may not be doing exactly what you think is an issue, but if you join them and you can bring it to their attention, maybe then that's something that you can work on together. And obviously, when you're working together, that's bringing hope into the community to make change.
Great. Yeah, thank you. So I'm hearing listening, right? Really getting out there and hearing the concerns of the community, hearing the concerns of the young people, right? What's benefiting them, what they love about their community, but also what's missing, right? Because we know that community connection is so important to substance use prevention. By listening and building infrastructure and building programming and building that community connection, you're really increasing that community resilience and that support for the people in the community, and then that creates hope. And those are some really important key components to preventing substance use and overdose prevention. So thank you. We wanted to, have just a little introduction to this idea with you today, and we appreciate your being here. If anyone does have any questions, you can chat them into the comments. If you want to ask Celeste, this very experienced community coalition leader, it's a great time to ask any questions if anyone has any. You can also contact Celeste through the partnership at Drug Free New Hampshire, through us, if you just email the partnership at, maybe one of my colleagues could type in our email address. But our website is www.drugfreenh.org. And you can contact us through our website, and I can put that right in touch with Celeste, or you can visit her website, Raymond Coalition for Youth. And if you Google that, it should come right up. But we really appreciate you being here today. And I do have a question in the chat. And my dear colleague did put in our email address and our website. Thank you. But the question is, what is the most rewarding piece of doing prevention work?
There are honestly so many. It's really hard to pick one. It's going out into the community and having a person who went through the program come up and thank you for all the work that you did, or thank you for being that adult that was there. You may not even know who the student is, and the work that you've done might have touched them, and you don't even know that happened. I was at a meeting recently, and there was a young woman there. She's in her late 20s, and she said that the coalition was like a hug on a bad day at school. And that I had no idea who this woman even was. And she said, going through school, sometimes it was hard, but you knew there were people who backed you and people that were there that you could go to if you needed them. And those are stories that you don't always know and you don't always hear, but they're out there. And then there's the other people who walk up and knock on your door and say, can I give you a hug because you made such a difference growing up? And again, you don't even know sometimes what you did to help these people, but just being there in the community and offering the resources for them. There are just so many of those stories. I could just go on and on, but it's very, very rewarding work. I love it. I love my job. I'm very fortunate to have it and work with great people and great kids.
Wonderful. Well, thank you. We really appreciate your being here, and we hope anyone who's listening will join us for the rest of the week. We have a Facebook Live each day at noon, right here, same place, same time, for each day of Prevention Week. From Tuesday, preventing substance use and promoting mental health in youth, preventing suicide on Wednesday, the talent pipeline, enhancing that prevention workforce, like what Celeste just talked about, how wonderful the work is and how rewarding it is. And then on Friday, really looking at all the efforts across the community and settings, how prevention is everywhere, and we all have a role. So thanks for being here, and we look forward to hearing from you again.
Yes.
Thank you.
Thank you.